Whenever you're ready. Alright, my name is Ryan Covington. This is my first attempt for trach suctioning competency. So the first thing I'm going to do is I'm going to apply PPE. I'm going to gather my equipment. There's a drape for the client, my suctioning kit, and a drape for my sterile field, and of course my gloves. I've also got some normal saline here that I have made sure is not expired and that it looks okay, is nice and clear. Once I've got all this together, I can enter the patient's room, tell them who I am. My name is Ryan. I'm here to perform suctioning on your trach, and I'm here for obvious reasons. I've probably found some crackles in the lower lungs, or maybe his O2 set has decreased. I'm also going to check his patient identifier, ask his name and date of birth, check that against his wristband. Like I said, I'm going to tell him why I'm here. I'm here to suction your trach. If at any point in time you feel short of breath or if anything hurts, just raise your hand to notify me, and that way I have established a means of communication. So next, oh yeah, of course I'm gonna perform hand hygiene. I'm going to get a baseline of his lung sounds. And of course, we've also got his O2 sat on his finger. And we're doing this, once again, establishing a baseline. He probably does have some crackles in his lungs or some secretions in his trach, and that's why we're here. So next, I'm going to drape the client. Once again, perform hand hygiene. I'm going to make sure that my suctioning equipment over here is working properly. I'm going to do this by turning on the suction and making sure it's between 5 and 10. The way I'm going to do this is I'm going to turn on the suction, fluid the top, and it should be between 5 and 10. If it's not, I will adjust it so that it is between 5 and 10. I can now see that it is. Turn that off. Perform hand hygiene. And now at this time, I'm just going to prepare my sterile field. Great. As long as I'm touching the outside, the inside is still sterile. Just going to touch the outside edge. All right. going to take my cup, right there, my normal saline, right into the cup. I'm not turning away from my sterile field. I'm now going to apply my sterile gloves. Once I've done this, move my suction catheter, my dominant hand, grab that, okay, and with this hand, I'm going to cut on my suction. This hand is now no longer sterile. I'm going to attach catheter. I'm going to ensure that it is suctioned by normal saline here. It is working. And with my non-sterile hand, I'm going to remove the oxygen, which has been hyperoxygenating up until this point. At this time, I'm going to insert it 4 to 5 inches or until he coughs or I meet resistance. Resistance, I'm going to intermittently put it down. Never want to suction for longer than 10 seconds. Open it. Here comes the tricky part. Now at this time I want to reassess lung sounds. Lung sounds are now clear. The suctioning has been successful. I can reapply oxygen, cut off my suction, of course, I'm going to reassess my patient, make sure everything's okay, check O2 again. Everything has been fine. He handled the procedure well. I'm going to remove my drape, throw all of this away. I'm not going to do it right now because we may need it shortly. Miss Lang asked us not to. And I'm going to wash my hands before leaving the room. And go document the procedure.